A tragedy in Newtown, Connecticut spurred a nationwide debate surrounding gun control in our nation. Those tragedies also highlighted the state of mental health in our country, and it forced local leaders to take a look at their state and county services. KEZI 9 News reporter Jennifer Richardson's live in the studio with an in-depth report on Lane County. Jennifer?
We found that Lane County is leading the way when it comes to providing health care. But like many counties across the nation, we lack the funding for prevention, which many agree is the most important aspect of mental health. And we are falling short when it comes to our youth.
Our nation sat paralyzed as these images blanketed our television screens. A gunman opening fire on little elementary school students and their educators. And quickly, the sadness at Sandy Hook Elementary School turned to questions of why. Many of these questions surrounding the alleged gunman, Adam Lanza, and his mental health. And that turned into a nationwide conversation.
The tragedy in the Newtown, Connecticut shootings and also the Clackamas Town Center shootings has really brought mental health to a forefront of public dialogue, and that's long overdue, and I'm glad we're talking about this again.
Teresa DaVigo is a division manager for Lane County Behavioral Health. On average, it serves about 6,500 different people a year. That includes children and families. At any given time, there are about 1,200 people who get mental health services at the clinic. And she's most proud of the community providers who are coming together to support the community.
The shame is that mental health disorders are treatable. And most people who receive treatment for mental health concerns do go on to recover and lead valuable, socially productive lives.
But she will tell you a major shift is needed when it comes to how we perceive our mental health.
We bring mental health into our daily routine, kind of like brushing your teeth and responding to our mental health and behavioral health every single day.
And just like brushing our teeth, she says we need to start young, which health experts say makes some recent findings in the Lane County school system that much more alarming.
We say we support prevention. We don't want this tragedy to happen. What are we doing differently?
Lane County Prevention Program Supervisor C.A. Baskerville says even Lane County knows what it's like to have a gunman open fire on students. You may recall in May 1998, at the age of 15, Kip Kinkle murdered his parents and then went on a school shooting spree that left 2 students dead and 25 others wounded. Fast forward 15 years and the violence ever so present. Baskerville recently surveyed 6th through 8th graders throughout the county. Drinking alcohol is still the #1 drug of choice, and guns are here.
And so even in Lane County, there was a very small percentage, but nevertheless there was some 6th, 8th, and 11th graders who took a gun to school.
Baskerville says in the past 12 months, 10.2% of 6th graders say they'd been threatened with a weapon on school property. 12.1% of 8th graders had been threatened, and 8.1% of 11th graders had been threatened. Baskerville says the majority of the kids surveyed admitted to being harassed and bullied.
I wonder, what are we doing? What can we do doing more of to help those kids?
She says Lane County also has a higher rate than the state average when it comes to young people who've considered suicide or experienced depression in the last year.
Almost 10% of our 6th graders attempted suicide last year. Almost 20% of our 8th graders.
And sadly, Darlene Baker knows the absolute agony of losing a child to suicide.
She left a note at school on Thursday telling people what was going to happen. Unfortunately, no one took the note seriously.
Darlene's daughter, Jennifer Baker, was a sophomore at Pleasant Hill High School when she took her own life.
We are not talking to our kids about mental illness. I myself did not talk to my daughter about mental illness. Never gave her any indication that she could come depressed and what she should do with that information.
After their daughter's death 15 years ago, Darlene and her husband started the Baker Foundation, helping to promote prevention efforts here in Lane County.
From when we started 10 years ago, schools didn't want to talk about it, parents didn't want to talk about it. I have, over those years, seen a change where people are more willing to talk about it. They're acknowledging that depression is something that our community is facing.
But that progress may be hampered because 4J schools were hit with another blow in March. Facing budget cuts, administrators decided to get rid of mental health programs, in turn looking to outside member agencies and providers to supply some of those services. This has outraged a number of teachers and school psychologists who say the key is starting with the youth.
There's lots of opportunities to intervene before someone gets to that dark place.
We need to put more money toward prevention, more toward mental health promotion.
What we are investing in, however, is our healthcare system. Oregon and Lane County are leading the way with the Coordinated Care Organization, or the CCO. Basically, it's one integrated system in which all of the specialists are communicating about your needs. The left hand is talking to the right hand.
So a mental health therapist could put in data and could look at what's happening with a patient related to diabetes.
Bruce Abel with Trillium Behavioral Health Plan says there's a profound relationship between our physical and mental health.
The hope is that we can create a delivery system that provides the best service at the earliest point that a condition is being identified, and then activate the patient and support that patient to feel responsible for their own health.
And taking responsibility seems to be the yarn that's weaving throughout the entire system.
Really, it is a community concern, and our community must come together and want this and really lift up this conversation to legislators, to lawmakers, and let's get real about what is possible for individuals.
And if Newtown showed us anything, no community is immune to the tragedies of one individual who didn't get the treatment they needed and decided hurting others or themselves was the only option.
If we want to make a change with that, if we want to, have those numbers go down, that's where we need to put our money, and we cannot continue to ignore mental health in this country.
And those we talked with say another alarming find when it comes to alcohol and drug treatment. Most people are being referred to treatment from the criminal justice system. This means oftentimes we wait until someone has committed a crime before we intervene with an alcohol and drug issue. Some wonder what kind of message this is sending. Live in the studio, Jennifer Richardson, KEZI 9 News.